It's really been a passion or interest of mine since I arrived back here at the University of Manitoba to create a graduate program that was really aimed at people doing research in the area of child health or pediatrics. The Mx Rady College of Medicine to create a program that could really train the future scientists in pediatrics and child health.
We hope our graduates and other graduates from the University of Manitoba will see this as an entry point for graduate studies. We are hoping that our graduates will then enter the research workforce, as well as health policy, and ultimately be suitable for jobs within the province of Manitoba.
Students will be housed in one of 4 different pillars, which broadly align with the expertise in our department. Those pillars include practice and policy, basic sciences, clinical research, and population health. Students will be housed in one of those 4 pillars, but also spend time in 2 of the other 3 pillars, such that they can pursue interests that broadly align with what their thesis topic is, but from a different angle.
So it gives our graduates a wide range of choices for which they want to pursue studies, and it creates a very diverse research as well as policy development workforce.
We wanted to be able to provide an opportunity for trainees to be part of this world-class training environment so that they could pursue graduate degrees, master's, and PhD level training. At present, there's only one other graduate training program in Canada focused exclusively on pediatrics. Our program is unique in that it really capitalizes on the multidisciplinary environment of our institutions. Being part of the graduate trainee program will allow trainees to be involved in multidisciplinary training both now, while they're trainees, but then also carry that forward and be able to work interdisciplinarily as they go throughout their careers.
My experience in research is the biggest breakthroughs and the biggest advances make when different disciplines come together to address a challenge or an issue. And I think through a graduate program, it's a great venue in which this can happen, because graduate students, you can bring in different supervisors, and they themselves can use their thinking process and critical thinking to help advance knowledge in that area. So it's a wonderful context in which this can happen.
So our faculty members within the Department of Pediatrics and Child Health are also members of CRIM, and they are members of the University of Manitoba, the Mx Rady College of Medicine. There is a unique synergy in having membership in all of those areas in terms of ideas exchanged, in terms of support for funding, and also in terms of supporting workforce development going forward.
I think it really was the notion that we want to train people to be the future so that there's a lasting legacy and sustainability of child health research in this province. And also, I think, to help energize the research programs themselves so that some of the really innovative or unexpected findings, scientific discoveries happen through graduate students being a part of it.
To date, much of the research that has been done in adults. There are certainly lessons that we can take away from that research and translate them to children, but there is a need to understand disease processes, pathology, the implications of disease on families, and understand that from a very patient-oriented, child-centered lens at the center of what we do.
As a department head, I firmly believe that excellence in research ultimately improves health outcomes, addresses health equity issues. So this graduate program has the ability to elevate child health.
The other thing is that there won't even only be here, but we will see the University of Manitoba graduates across Canada, around the world, really making high impact. So yes, we want to impact the province, but we want to be so good that anyone who is looking for a pediatric child health researcher will look to this program to recruit that next person.